Apixaban to prevent venous thromboembolism in patients with cancer. Apixaban definition. It is a type of a medicine known as an anticoagulant or blood thinner. It makes your blood flow through your veins more easily. This means your blood will be less likely to make a dangerous blood clot.
Health Matters is the informational webcast brought to you by NetMeds, designed to keep you informed and up to date on popular medicines, emerging therapies, and even cutting-edge strategies for enhanced wellness, less sickness, and greater energy. This medicine belongs to a group called anticoagulants. It is used for the treatment of stroke, clots after a hip or a knee replacement operations, in patients with an irregular heartbeat, clots reoccurring in the blood vessels of your legs and lungs. Talk to your doctor before taking this medicine. If you are allergic to Apixaban, if you have a disease that increases the risk of serious bleeding, if you have very high blood pressure or any heart or liver disease, if you are older than 75 years or weigh 60 kg or less, if you had a tube or an injection into your spinal column, if you need to have a surgery or a procedure. The effects of this medicine on pregnancy and the unborn children are not known. Consult your doctor for advice. Tell your doctor if you are taking medicines such as medicines used for treating fungal infections, HIV, tuberculosis, pain, epilepsy, depression, heart problems, or high blood pressure. Stop taking this medicine and contact a doctor immediately if you notice any of the following side effects such as anemia marked by tiredness or paleness or nausea, blood in the urine, bruising and swelling, vaginal bleeding, bleeding in your gums, nose, stomach, brain, vagina, dark or blood-stained stool. For further details, refer consumer medicine information at netmeds.com.
Venous thromboembolism in patients with cancer. Patients with active cancer have an increased risk of a venous thromboembolism, which results in substantial morbidity, mortality, and healthcare expenditures. The Cochrane score range 0 to 6, which higher the scoring indicating a higher risk of venous thromboembolism, has been validated to identify patients with cancer at elevated risk for the complications and may help select those who could benefit from thromboprophylaxis.
Cancer can be a difficult diagnosis, with many new and overwhelming things to learn about and manage. Your top priority is to get well. In addition to the other steps you may be taking to protect your health, it's important that you learn about your risk for dangerous blood clots. Cancer and some of its treatments can increase a person's risk for blood clots. Blood clots affect about 900,000 people in the United States every year, and 1 in 5 of these clots will be among people with cancer. Blood clots are a leading cause of death among people with cancer, and the risk of a blood clot is highest in the first few months after diagnosis, the time when treatment generally begins. Blood clots occur most often in the legs. A blood clot in your leg can move or break apart and travel to your lungs, which can be life-threatening. Talk with your healthcare team about your increased risk for blood clots. Make sure your healthcare team knows about your personal and family history of blood clots. Also, make sure that you recognize the signs and symptoms of blood clots. If you have been diagnosed with cancer, it's also important to understand your risk for blood clots. Some cancers pose a greater risk, including cancers involving the pancreas, stomach, brain, lungs, uterus, ovaries, and kidneys, as well as blood cancers such as lymphoma and myeloma. And the higher the stage of cancer you have, the greater the risk. Also, cancer treatments involving chemotherapy, surgery, hormonal therapy, and catheters placed in your veins can increase your risk. Lastly, other factors can increase your risk. The signs or symptoms of a blood clot in your leg or arm can include swelling of your leg or arm, pain or tenderness not caused by an injury, and skin that may be warm to the touch and red or discolored. If you experience any of these signs or symptoms, talk to your cancer doctor or healthcare provider as soon as you can. The signs or symptoms of a blood clot in your lung can include difficulty breathing, chest pain that worsens when you take a deep breath, coughing up blood, and a faster than normal or irregular heartbeat. Seek immediate medical attention if you experience any of these symptoms. Work with your healthcare team to make a plan to help prevent blood clots, stop the clot, and protect the most important thing, your health, during your cancer treatment.
What is cancer-associated thrombosis and what are the concerns with healthcare?
Well, I know as a patient who's experienced venous thromboembolism, you know a lot about blood clots.
Absolutely.
And this is pretty much the same thing, but it is something which happens when people have cancer.
Okay.
Why is it serious? Well, for all the same reasons as someone who has a blood clot without cancer, that it can cause pain, it can cause discomfort, and untreated, it can sadly kill you.
Why certain cancer patients are prone to clotting? Are there health risks for some versus others?
Absolutely. I think all cancer patients have an increased risk of blood clots compared to the general population.
Yeah.
And that's primarily because the tumour releases molecules into the blood which can make the blood more sticky.
Okay.
But not all cancers are the same. We will find that someone with cancer of the brain, of the pancreas, of the lung, of the ovaries, their blood is more sticky than someone with breast cancer or prostate cancer. But it's not just the type of cancer, it's the stage. So if you have a cancer that has spread to other parts of the body, and we call that metastases, that can increase the risk of blood clots 19-fold. Then, if we add in treatments like chemotherapy, that will increase the risk further. So if I illustrate it, someone with breast cancer, which may not be a particularly thrombotic or clotty condition, if you have someone who's had early stage breast cancer, no spread of tumour, and they're having no chemotherapy, the risk of blood clots is 0.2%. But if you give them curative chemotherapy, the risk goes up tenfold to 2%. In that same group of patients, if they had metastases, so the cancer has spread and you gave them chemotherapy,
Yep.
the risk was 8%.
Wow.
So one size does not fit all.
Yeah.
It depends on the tumour, the stage, the chemotherapy, and of course any other illnesses they have which may increase the risk as well.
Application in medicine. We can use it at randomized, placebo-controlled, double-blind clinical trial assessing the efficacy and safety of Apixaban 2.5 milligrams twice daily for thromboprophylaxis in ambulatory patients with cancer who were at intermediate to high risk for venous thromboembolism. Current score more or equal to, and were initial chemotherapy. The primary efficient outcome was objectively documented venous thromboembolism over a follow-up period of 180 days. The main safety outcome was a major bleeding episode. Results of the 500 7 for patients who underwent rhabdomyolizations. 563 were included in the modified intention to treat analysis. Venous thromboembolisms occurred in 12 of 288 patients, that is 4.2% in the Apixaban group, and in 12.8 of 278 patients, 5 patients, 10.2% in the placebo group. In the modified intention to treat analysis, major blending occurred in the patients, 3.5% in the Apixaban group, and in 5 patients, 1.8% in the placebo group. During the treatment period, major blending occurred in 6 patients, that is 2.1% in the Apixaban group, and in 3 patients, 1.1% in the placebo group. Pros: the ABERT trial showed that thromboprophylaxis with apixaban result is a significantly lower range of venous thromboembolism complications that placebo among ambulatory patients with cancer who were starting thermotherapy and had a Corin score of 2 or higher. Venous thromboembolism in patients high cancer who are receiving chemotherapy has a substantial effects on care, including an increase in healthcare expenditure and negative effect on quality of life.
Patients with cancer have an increased risk of venous thromboembolism, but parenteral thromboprophylaxis is not routinely recommended in practice guidelines because the absolute risk reduction is modest, and parenteral thromboprophylaxis is associated with an increased risk of major bleeding, as well as the inconvenience of daily injections. Could a direct oral anticoagulant such as Apixaban, used as a thromboprophylactic agent in patients with cancer, offer advantages over parenteral agents, particularly with regard to convenience? The randomized placebo-controlled double-blind AVERT trial included ambulatory patients with cancer who were at intermediate to high risk for venous thromboembolism with a Corona score of 2 or more. The Corona score has been validated to identify patients with cancer who are at elevated risk for thromboembolism. The trial patients were randomized to Apixaban for thromboprophylaxis before chemotherapy or to placebo before chemotherapy. The primary outcome was objectively documented venous thromboembolism over a period of 180 days. In a modified intention to treat analysis, venous thromboembolism occurred in 4.2% of the 288 patients in the Apixaban group and 10.2% of the 275 patients in the placebo group. The number needed to treat to prevent venous thromboembolism was 17. The main safety outcome was major bleeding. Major bleeding occurred in 10 patients in the Apixaban group and 5 patients in the placebo group. The authors conclude that Apixaban at the initiation of chemotherapy resulted in significantly lower rates of venous thromboembolism than did placebo among intermediate to high-risk ambulatory patients with cancer. The rate of major bleeding episodes was higher with Apixaban than with placebo. Full trial results are available at nejm.org.
Cons: the treatment of a venous thromboembolism with therapeutic anticoagulation is changing in patients with cancer because it often involves daily injections of low molecular weight heparin and is associated with the high risk of thrombosis, recurrent and serious blending complications, coexisting conditions that are common in this context, such as thrombopenia and renal impairment, as well as the use of concomitant antiplatelet therapy in 12.8% of our patients. Further increase the risk of blending among patients with cancer. Therefore, prevention of venous thromboembolism complication is important and clinically relevant. Issue applied in Ecuador. In Ecuador, Apixaban is used for therapeutic of heart failure in older adults. Other application is for stroke prevention in non-valvular atrial fibrillation in public healthcare sector of Ecuador. In conclusion, Apixaban therapy results in a significantly lower rate of venous thromboembolism than did placebo among intermediate to high-risk ambulatory patients with cancer who were starting chemotherapy.